With the recall election less than a week away, we're continuing to focus on the issues in the race. In the last few days, we've covered collective bargaining and jobs. Tonight, Fox 11 on special assignment takes a closer look at where the candidates stand on health care. And Robert Hornacek joins us with a preview. Good morning, Robert.
Good morning, Rachel. You know, there are more than 1 million people in Wisconsin who receive some form of medical assistance. We're talking about programs like Badger Care, Family Care, and Senior Care. And those programs cost taxpayers billions of dollars. Now, in a recent TV ad, Governor Scott Walker touts the fact that he added $1.2 billion to the state's medical assistance programs in his budget. He says that's more than any other governor in state history. Walker's critics have run TV ads of their own, bashing Walker on health care. They point out the governor did not allocate enough money to the programs to meet their projected growth.
It's important for us to do what we can not to push people off Badger Care. And he's reducing the number of people that are on Badger Care. I think it's important to obviously do what we can to control costs, but let's not control costs by taking away people's health care, because all they're going to do is go to the emergency room. And that's a far more expensive and inefficient way to deliver health care.
The changes we made, I think most people would say pretty reasonable. Our changes say, you know what, if you work for a company and they have health insurance, you should take that before you ask the taxpayers to pay for it. If you're in your 20s and your parents have health insurance, you should take that before you ask the taxpayers to pay for it.
We'll have more on the changes Walker made to the medical assistance programs and what Barrett has to say about them tonight on Fox 11 News at 9.
So how big are these programs?
Well, they're very large programs. When you look at the state budget, the majority of the state budget goes to local state aid to school districts. But after that, Medicaid, the state's medical assistance programs, are one of the top programs. I think it makes up about 10% of the state budget. So for the state share for these programs ends up being more than $5 billion. So that's a lot of money.
And what about the federal health care law?
That's also been an issue. Scott Walker, the governor, has been a very outspoken critic of the plan. He says the Affordable Health Care Act is not a good idea. He's directed the Attorney General to challenge it in court. He also turned down more than $37 million in funding from the federal government to set up what were those health insurance exchanges, which were kind of one of the first implementations of the plan at the state level. Tom Barrett told me he supports those exchanges, and if he has his way, if he's governor, he's going to try to implement them.
All right, we'll learn more and hear more from the candidates tonight at 9. Thanks, Robert. And if you missed our first two reports on collective bargaining and jobs, you can watch them on our website, fox11online.com. Just click on the special assignment tab. We'll be right back.